Good Monday morning, everybody. This is Dr. Sanders here with Western Healthcare Exposed. Today is Monday, June 19th. I wasn't really planning on talking about the topic today, but I was listening to a medical podcast over the weekend, and something was mentioned that coming up here soon, don't know when, but that there is a new code that we're going to have to start putting in patients' charts to document whether they are COVID vaccinated or unvaccinated. This is going to be due to a couple reasons. One, it is going to be tied to whether we get paid or not, if it's documented that they've had the COVID vaccine or not. And it's also going to be tied to whether the patient most likely has coverage for insurance in the future or is allowed to have certain types of care done. And so when I heard that, I was like, well, I don't know if that's really true or not because I've not heard anything about it. So I got to looking it up. And I am currently on the CDC page right now. And at this time, and this is as of March 10th of this year, it says only skilled nursing facilities are required to report COVID-19 vaccination status. I am not sure why they are the only ones. That is a type of long-term care facility, so I'm not sure why they're the only ones at this point that have to document that and send that in to be reviewed by CMS. But anyway, it is tied to CMS quality reporting data. And what quality reporting data is a whole bunch of stuff that has been gradually put out over the, I don't know, probably more than a decade, where physician reimbursement is tied to whether we are reporting particular metric points that they want to see. Now, these metric points have absolutely nothing to do with the quality of care a patient's receiving or how well they're doing or anything like that. So I just don't understand the point of these things, but this is what they are tying our reimbursement to. So if this is a quality reporting metric, you can guarantee that if skilled nursing facilities are not reporting COVID vaccination status, their reimbursement has fallen. I do suspect, since they are already having to report this, that in the future that hospitals and other facilities will have to start reporting it, as well as individual physicians reporting it on their patients from their office. I don't 100% don't agree with that. I think this is crazy, but that's what CMS is doing. So if you notice over the coming months to maybe a year, if you go to the doctor and your doctor's asking about your vaccination status and whether you've had it or if you want it, that may be why, because they are scared that their reimbursement is going to fall. It has nothing to do with them thinking that the vaccine's good for you. Maybe it does. Maybe they love the vaccine, but is more than likely going to be tied to specifically whether they're going to get reimbursement from insurance companies for treating you. And then, while I was looking this up, I came across this other article that I thought was very interesting, and this is from September 2021. And this really goes along with what I was seeing when I was in the hospital doing critical care back during COVID. And this was mentioned many times by nurses, physicians, administrators, that if a patient chooses to be unvaccinated, they should not receive care. That is 100% true. I am not making that up. But this article right here says, the title is, Can Physicians Decline Unvaccinated Patients? And the opening paragraph says, in general, no, a physician should not refuse a patient simply because the individual is not vaccinated or declines to be vaccinated. The commitment to care for those who are sick or injured carries with it a duty to treat in other circumstances as well, including public health crises when a physician may face greater than usual risk to their own safety, health, or life. So reading that opening paragraph, you would think, oh, okay, well, they really, this is from the American Medical Association webpage, by the way, but you would think reading that physicians would want to treat patients that are sick. That is why we went into the profession in the first place. But no, going on to the next paragraph, there are multiple bulleted points that are in response to this statement, which is the opening sentence to the next paragraph. However, the strength of a physician's obligation to treat may vary under different circumstances, and determining whether, in a particular instance, a physician may ethically decline a patient requires careful reflection. And then it goes on to say what some of these things are that physicians may be reflecting upon to decide whether a patient needs treatment or not. And these would be, what are the unvaccinated patient's medical needs and how urgent are those needs? What is the nature of the physician's practice and patient population? If an unvaccinated patient would pose significant risk to other patients in the practice, for example, if physicians' patients are immunocompromised or cannot be vaccinated for medical reasons, it may be ethically justifiable to refuse an unvaccinated individual. That is hilarious because it has been proven multiple times that the vaccine does not prevent disease, nor does it prevent transmission. As a matter of fact, people that have been vaccinated are in the hospital at least as much as unvaccinated, if not more than unvaccinated patients. So this is hilarious that they're writing this in the American Medical Association. Next bullet point. Beyond robust practice, wide infection control efforts, can accommodation be made to minimize the risk an unvaccinated patient may pose to other patients and staff? What kind of risk are we going to pose to other patients and staff because we have not had a COVID vaccine? As I said, it does not prevent transmission. It does not prevent disease. As a matter of fact, vaccinated patients may pose a risk to the unvaccinated patient by harboring viruses that have mutated because of the vaccine, and they may spread that to the unvaccinated people. So again, this is crazy. Next, can the practice provide physicians and other staff with adequate personal protective equipment to minimize risk of exposure? Well, I don't know what kind of personal protective equipment we need. I'll probably do a whole series on COVID coming up, but this article just caught my eye when I was looking up this other that we just talked about. And then the last bullet point is, can the patient be persuaded to accept vaccination? Well, they want us to offer spaghetti dinners and plane tickets like they were doing when vaccination first came out. I mean, what time in history have we ever bribed patients to receive some type of therapeutic before? Never. This is insane. They want us to persuade patients to accept vaccination. It says, when an unvaccinated patient presents for care, physicians have an opportunity to explore with the patient why they are not vaccinated, respectfully acknowledge and address their concerns. So there's been no respect at all from most of the healthcare providers in the United States to people that are unvaccinated. So this article is hilarious, but again, I just wanted to bring this up because I found this while I was looking about having to document whether somebody's vaccinated or not. But anyway, like I said, I'll do a whole bunch more stuff on COVID probably coming up, but I just wanted to get that out to let y'all know what it may be coming down the road for documentation purposes and about this article that I just found about physicians refusing care. Anyway, y'all have a good day. I'll see y'all next time on Western Healthcare Exposed. If there's anything that y'all want to talk about, just leave it in the comments and I will do my best to get to it. All right, I'll see y'all later. Talk to you later.